Okay, so this is the recording for Module 8. We're only doing the concept of immunity. I'm going to focus on what parts of this you need to understand as an entry-level nurse. The functions of our immune system: protect the body from foreign antigens, identify, destroy potentially harmful cells, and remove cellular debris. How does our body do that? Protecting from foreign antigens, if you think about it, we have our skin, that's a barrier. We also have our tears to help wash things out. We have our saliva to break down bacteria in our mouth. We have cilia that's in our nose and throughout our airway to help remove that debris. Our body produces blood cells in our bone marrow. I'm trying to think, lymph node. I guess this is supposed to be here in our whole lymph system, this picture. But remembering our blood cells are produced in our bone marrow. They produce our red blood cells, most of the white blood cells, and our platelets. Some terms to be aware of: if your white blood count is low, it's leukopenia. If your platelet count is low, it's thrombocytopenia. If your red blood cells are down, it's an anemia. If all of those are down, it's a pancytopenia. If your white blood count, we have two types of white blood cells, T and B lymphocytes. They're produced in our lymph node and our spleen, and some T cells are produced by our thymus, which is over here, part of our immune system. So our body's response to an infection, fighting an infection, is it produces more white blood cells. So an increase in white blood cell count is leukocytosis, which you would see in response to an infection in the systemic body. Okay, so immunity is our body's natural induced response to infection and conditions associated. Immunocompetent. Just look at the word competent. Our body immune system is working effectively to destroy and remove things that are harmful to us. So that's immunocompetent. Whereas immunodeficient is our immune system is not competent or incompetent to respond effectively. Hypersensitivity is our body overreacts, our immune system overreacts to things, which we call an allergic response. And autoimmune disorders, it's our immune system loses its ability to recognize and attack, and it beginning to attack its own tissue. Okay. Important to understand passive and active immunity when we get into immunizations. So that is what I want you to get out of this. Active immunity occurs through exposure to disease or vaccination. The causative organism triggers our body to produce antibodies. Here, that's our natural immunity. Vaccine-induced immunity is where a vaccine introduces a weakened or killed organism for our body to then produce antibodies. That is, active immunity means our body had to do something, had to be actively involved, versus passive, where our body does not produce the antibodies. The antibodies are introduced into our body. So that's placenta, passed from the mom to the baby, is passive, and breast milk. There are certain antibodies that are passed through the breast milk. And immunoglobulin, IgG, giving somebody IgG or immunoglobulin because they've been exposed to something that they don't have antibodies for, so you give this to stop that risk of producing that infection. All of these are immediate, that's the benefit, but the problem is it only lasts for a few weeks or months. So getting antibodies from the breast milk, from IgG injection, from a baby through the placenta at birth is not long lasting. So it's an immediate protection, but it doesn't last. Where active immunity, either we our body has to do something actively involved to produce antibodies, but then that is long-term, although it takes weeks to develop. Okay. Antigens are what cause our body to have this immune response. Often they're proteins in the cell wall of microorganisms or tissues. Multiple things can cause us to produce antigens. Our vaccines, incompatible blood, where we'll have a hypersensitivity reaction. Pollen, egg whites, animal dander are very common allergies because of hypersensitivity. Our immune response, when we're exposed to the antigen, the B lymphocytes produce antibodies. That's our primary response. We start to produce the antibodies. Secondary response is after we've been exposed a second time. So you think of somebody with an allergy and having that hypersensitivity, you usually don't react the first time exposure. Like if you're taking a medication, it'll be the third dose or the third day where suddenly you have a reaction. Somebody might be exposed to something and they don't react the first time, and then the next time or over several days, then they're suddenly reacting, because here the secondary subsequent encounters trigger the memory cells. So it only takes, says within about 24 hours, we produce these memory cells. So when we're exposed again, we're going to respond. That's as deep as you need to go. So don't sit there and go further than I'm telling you to go. IgM is the first antibody made to fight infection. I think of IgM as immediate, IgG as gone. When you're doing lab work to check for immunity to certain things, or do they have this infection going on right now, or is it an infection they've been exposed to and they've produced these antibodies? So you're looking for IgM, immediate, that's responsible for primary immunity. You'd see it right away. IgG, it's happened. We have major immunoglobulins and the infection is gone. IgG that's for blood work. And then IgG is also what you give somebody that's been exposed to something that they're not immune to, a disease or a bacteria. Common giving IgG would be if somebody has been exposed to rabies or tetanus. So we get regular tetanus toxoid shots, but if we've not had a tetanus shot and we have a potential exposure to tetanus, we will get tetanus IgG to have immediate protection and then get a tetanus toxoid. So over the few weeks, our body is then producing the long-lasting antibodies. So we would get both in a situation like that. Okay, so our natural barriers. We have responses. It's a non-specific inflammatory response. Something comes at us and our body first tries to protect with our skin, with our cilia, with our saliva, with our tears, bactericidal substances in our body. Our body that's our primary first line of defense. Our second line of defense is if it's gone in. Suppose you have a crack in your skin and something invades, you get the swelling and inflammation. That is because our barrier is breached. We have inflammation. And then we have, if it gets in, we have all the white blood cells, macrophages that come and engulf it. That's where you'll see the pus and the yellow and things trying to engulf it to help us clear the infection. Okay, genetic lifespan considerations. Our immune function changes across our lifespan. It's where the very young, the very old. Think of that way. Our immune system is not fully formed when we're born and we're very young. So children are more susceptible while their immune system is developing. Then when we get older, our immune system starts to decline. Our bone marrow isn't as zealous. Our whole immune system is decreasing, so it again puts it at higher risk for infections. Declining immune function in older, more prone to infection. We also don't show the same symptoms. Don't think I have that on a later slide. So, or slower response. So, sepsis is infection throughout the body system. So, an elderly person, older person, over 65, or immunocompromised person won't show the robust response like a younger person might have a temperature, say 20, 30-year-old healthy, might have pneumonia, and they're going to have a fever of 102, over 101, showing a bacterial infection, even a bad urinary tract infection that has become systemic, where an older person might have a fulminating pneumonia and only have a temperature of 100 or 99.5. Or they'll have a significant urinary tract infection that's gone up into the kidneys and not have a fever. So you're looking for multiple signs, not always looking, because they won't always have that prominent immune response. So our primary immune response deficiencies can be congenital, can be that our T cells or B cells or bone marrow is not doing, it may be resulted defects in our white blood cells. Secondary immune deficiencies, AIDS from HIV, human immunodeficiency virus, can be because of cancer, multiple traumas and stress that suppress our immune system. Children I talked about, greater risk of allergies, especially if the parent sibling, that's where the genetics come in, of having more hypersensitivity reactions or weaker immune systems. Many conditions with the immune system are more prevalent in the female population. African Americans have higher rates of transplant rejections. Modifiable risk factors, this is things that we can change, which is why it is so important to teach health promotion, which goes along with prevention, disease prevention. There's nutrition related to development of food allergies, when you introduce what foods you're giving. Being underweight or overweight affects our immune system. That's underweight, a BMI under 18.5, overweight, a BMI greater than 25 I think it's 9. Stress, chronic stress leads to a higher endocrine response and negatively impact our immune system. Alcohol, drugs, cigarettes decrease our immune response. Unprotected sex leaves risk in exposure to human immunodeficiency virus, which will suppress our immune system. Okay, immunizations. Introduce the antigen in the body and allow the body to develop these antibodies. So that is your active immunity by giving you these immunizations. Giving IgG, immunoglobulin, is a passive immunity. It does not last. So your vaccine is giving your IgM. Okay. Now this slide, you will see questions on this slide. So you need to understand the different types of vaccines. Killed virus vaccine. Microorganisms that have been killed. It's in the name, killed virus vaccine. Inactive polio is one of those. Toxoid, I mentioned the tetanus toxoid. Toxin that has been treated to weaken the toxic effects, but to retain the antigenicity. So you'll be given a tetanus toxoid, so your body will produce the antibodies and become immune to tetanus. Live virus vaccines are microorganisms that are alive, but they're weakened, such as measles, varicella. Those are viruses. Recombinant recombinant forms. They've been genetically altered. We think of recombining it. Genetically altered is how I remember it. Toxoid, a toxin, is altered to make it not dangerous to us. Killed is a killed back microorganism. Live is a live virus. Conjugated forms, altered organism joined with another substance. Conjugated, coming together. So it's a combination to increase our immune response. And that's with your influenza vaccine. So I'm not going to ask you for examples of which type, but just to understand those 5 types of vaccines. Response to vaccinations. Understanding when it's a bad reaction and an expected or okay reaction. You often will have a localized reaction to a vaccine. I'm sure at some point you've had a shot, you've had a little bit of redness, swelling, pain, a little bit of firmness at the site. Systemic is when it's your whole system. Fever, irritability, malaise, loss of appetite. When you're administering vaccinations, very important to teach about these possible reactions. It is rare to have a serious reaction. Those are reportable events, which we'll cover more in later courses. A local reaction, although it can usually occurs in minutes, it can be hours after injection, so that's why it's important to teach. Non-life-threatening is where it's urticaria, some itching around the site, transient petechiae, the little red spots. Life-threatening is obviously anaphylaxis, swelling in the airway, and inability to breathe. Contraindications to giving an immunization is acute illness with high fever. 100 degrees is not a high fever. 101 is a high fever. Hypersensitivity reaction, if they've ever had an allergic response to an immunization or something in that immunization. Egg is in certain immunizations, but some now are coming without that. Recent immunoglobulin therapy. There are people that have a very suppressed immune system and have to get infusions of IgG. If they just had IgG therapy, then they should not get a vaccination while their body's already actively processing this. If they're on cancer treatments, and no live vaccines. You can get the influenza vaccine, the dead vaccines during pregnancy, but no live viral vaccines. Important to get informed consent, educating. There are these VIS forms, vaccine information sheets, that are given with vaccination. Discuss them about herd immunity, which you should have covered in pathophysiology, I believe, on herd immunity, and you'll get more of that in pediatrics. And here, in most settings, the responsibility falls on a nurse. It is to teach them and to educate that vaccines don't have these terrible things and they don't cause, not Asperger's, autism. That is a myth that has been proven incorrect and unsubstantiated. Diagnostic tests. There's lots of tests to check for immune responses. I just wrote them here for you to be familiar. Your ELISA test that detects and measures antibodies in your blood, looking at your IgG, IgA, IgM for your immune response. Rapid HIV tests, PCR, is your polymerase chain reaction, checking for specific DNAs. Skin reactions, the allergist will do that, looking for reaction to some protein or something to check for allergies. Your complete blood count is looking at your white blood cells, your red blood cells, and then they can do a differential where they break down your white blood cells, which is very important for checking for infection, which we will cover in Module 9 a little deeper. Independent nursing interventions. These are things that you don't need a doctor's order for our providers order to do. Educate, educate, educate. Teaching about lifestyle, nutrition, weight management, resources are out there trying to get physically active, plus exercise, sleep hygiene, stress reduction. Older adults, normal changes with aging is that we have a decreased immune response, lower resistance, poor response to immunizations. That's why they now have the vaccine for influenza at age 65 and older. That is like 65% more robust than the regular influenza because they are so prone to have complications if they develop influenza. And that's part of nurses' responsibility for education. Okay, so I am done with this module.